Hello everyone. So today we are going to discuss about the external ear. Actually, we have been reading about ear since a long time. We all know that ear has three parts, that is external, middle and internal ear. So today we are going to discuss about this external ear. So in this diagram we can divide the ear into three parts. So up to here, up to the tympanic membrane is the external ear, then the middle ear, and then after the middle ear this is the internal ear. So this is the basic three parts of the ear, and we are going to discuss about the external ear today. Okay, so external ear is basically consisting of auricle and external acoustic meatus. So today we are going to discuss the auricle, which is also called the pinna. Okay, so what is the function of this auricle? It collects the sound vibrations from the ear. So this is the basic function of this pinna, and it is composed of skin covered single piece of yellow elastic cartilage which is continuous with the cartilaginous part of external acoustic meatus. And the cartilage is however absent in the lobule of the ear. Here is the lobule, which is made up of fibrofatty tissue. So this external acoustic meatus is extending inward from the bottom of the auricle up to the tympanic membrane. Now we are going to discuss about the features of the auricle. So in this picture you can see the different features of the auricle on the lateral surface. So the auricle, we can divide the auricle into two surfaces, the lateral surface which is irregular and presents a concavity facing forward and laterally. So whatever is visible in this picture is the lateral surface of the auricle, and whatever is behind this will be called the cranial surface or the medial surface. Okay, so we are going to discuss the features on the lateral surface. So lateral surface is displaying many elevations and depressions. The first one is the helix. Okay, so helix forms the prominent peripheral rim. Okay, so this is the helix. Its anterior limb descends as the crus of the helix into concha. So this anterior limb is descending into the as the crux of the helix into the concha and divides the concha into upper and lower parts. Okay, so this is the crus of the helix, and the posterior descending limb of the helix presents occasionally a prominent Darwin's tubercle here. So it is an occasional appearance. It is not found in all the auricles, but occasionally it may be found. There is a tubercle which is called the Darwin's tubercle. Okay, so this is about the helix. This is helix. Now antihelix. So antihelix is another prominent margin lying in front of and parallel with the posterior part of the helix. So it is in front and parallel with the helix, and it partially encircles a deep depression, that is the concha. So here is the concha, and this antihelix is partially encircling this concha. Okay, so this is the concha. Now when we are tracing the antihelix above, then it is dividing into two crura. Okay, and these two crura are enclosing a depression that is called triangular fossa. So this is the triangular fossa which is enclosed between the two crura of the antihelix. And the narrow gutter between the helix and the antihelix, here lies the scaphoid fossa. Okay. Now, the depression of the concha is guarded in front by a triangular flap of cartilage that is called tragus. So you can see this is a flap of cartilage which is triangular. This is called tragus. And opposite the tragus is the antitragus, and they are separated by what is this? This is the intertragic notch. So this is tragus, this is antitragus, and here is the intertragic notch. Okay. The small part of concha which is above the crus of the helix, somewhere here, is called the Simba concha, and it is providing the topographic position of the suprameatal triangle. Okay, and the large part of the concha below the crus presents the outer opening of the external acoustic meatus. And the final one is the lobule of the ear, which is hanging below the antitragus as a skin covered flap of fibrofatty tissue. So this is the lobule of the ear. Okay, so these are the features of the lateral surface of the auricle. Okay, so muscles of auricle, in your point of view, it is not very important, but you should just know the names of the muscles. The muscles are divided into two, extrinsic and intrinsic. Extrinsic muscles include auricularis anterior, auricularis superior, and auricularis posterior. The auricularis anterior and superior are supplied by the temporal branch of the facial nerve, and the auricularis posterior by the posterior auricular branch of the facial nerve. And these muscles move the auricle as a whole. But this movement is not significant in man. Some of you might move your auricle. So in some people, these muscles are active, but otherwise these movements are not significant. And in the intrinsic muscles, helicis major and minor, tragicus, antitragicus, transversus auriculae, and obliquus auriculae. So these are not very important. Okay. Now the most important part of this pinna is the nerve supply. So you must know about the nerve supply of the pinna. Okay. So there are basically four nerves which are supplying the pinna. The first one is the great auricular nerve, and it is supplying most of the cranial surface and posterior part of the lateral surface, including helix, antihelix, and lobule. So great auricular nerve is supplying the pinna. The second one is the lesser occipital nerve. It is supplying the upper part of the cranial surface of the auricle. The third one is the auriculotemporal nerve, which is supplying the anterior part of the lateral surface, including tragus, crus of the helix, and the adjoining area of helix. The fourth one is the auricular branch of vagus, which is supplying the concha and the corresponding eminence on the medial surface. Okay, it is also assumed that facial nerve, few fibers, they accompany the auricular branch of vagus and supply the region of concha. But this is a rather controversial thing, but it is being presumed that the facial nerve fibers also come. Okay, so this is a picture which is showing the different areas of innervation. Here you can see this is the area. The purple one is for the great auricular nerve, the green one is for the facial and the vagus, the orange one is for the auriculotemporal. So this is the lateral surface, and this is the cranial or the medial surface. So here upper yellow one is for the lesser occipital, then the purple one is again for the great auricular, and the green one is for the facial and the vagus. The arterial supply of the auricle. There are three main arteries: the posterior auricular branch of the external carotid, which is supplying the cranial surface, and the posterior part of the lateral surface of the auricle. Then the anterior auricular branches of the superficial temporal artery, which is supplying the anterior part of the lateral surface of the auricle, and a few branches of occipital artery, which is supplying the upper part of the cranial surface. Then the venous drainage. Veins accompany the arteries and drain into superficial temporal and external jugular veins. There are numerous arterio-venous anastomoses beneath the skin of the auricle. What happens in cold atmospheric temperature? These arterio-venous anastomoses dilate, and hence skin cracks might affect the auricle in winter. And that is why we find comfortable to move in cold season by wrapping the pinna with a piece of warm clothing. We all have experienced that when we cover, we feel comfortable. So this is the reason, because there are numerous arteriovenous anastomoses.